Welcome to Gilda's Claw's presentation of lymphedema exercise and cancer and exercise, sorry. So today I'd like to recommend or welcome Amy Rudolph as our speaker, and we are thrilled to have you. So I will hand that over to you now, Amy. Thank you.
Awesome. Thank you, Anita, for having me. And thank you for everyone that has come to spend their afternoon here a little bit and learn about lymphedema and exercise and some other special topics. So thank you again for joining us. I'm just going to go ahead and get started. Lymphedema 101 is the name of the class. We're just going to kind of keep it general, talk about some special topics and that kind of thing. So a little bit about me. Again, my name is Amy Rudolph. I am a physical therapist and a certified lymphedema therapist. And I also received my certification as a cancer exercise specialist about a year and a half ago. Graduated here in Kansas City from Rockhurst University way back when in the early 1990s. The last 10 years of my clinical practice have been in oncology rehab. And then about maybe a little over 5 years ago now, I received my certification as a lymphedema therapist and pretty much have practiced solely with people dealing with lymphedema for those 4 to 5 years in my clinician setting. I currently have a little business on the side. I do wellness coaching and personal training for cancer survivors and anyone with a chronic illness. So I wanted to put my email in here at the bottom. If you want to jot that down, I am always open for questions about any of the topics discussed here, whether it's something you think about later this evening or something you might think about a few months from now. I'm always open for questions and dialogue. So please feel free to take down my email, and I have an open door. So let's go ahead and dive in. So I'm going to just kind of give you a general outline at first of what I'm going to be talking about. We're going to talk about the lymphatic system. We're going to keep the anatomy lesson kind of short and sweet. We won't dive really deep into that, but I think it's important to kind of talk about it, what it is, and what role it plays in our bodies. And then we're going to move on to lymphedema and its risk factors, what puts us more at risk for lymphedema, and talk a little bit about that. Then we're going to move into some popular topics and questions. I wanted to talk about these things because as a clinician, I felt like these were the top things that I got asked about most. People were most concerned about how to reduce their risk for lymphedema. Can I exercise if I'm at risk for lymphedema or if I have lymphedema? And then talking a little bit about air travel and what that looks like. Probably not as prominent as it once was these last few months, but still it's an important topic, and hopefully we'll be getting back to doing more of that in the future. And then we're going to talk a little bit about BMI or body mass index, exercise guidelines, which is a popular topic for me to discuss, one of my favorites. And then at the end, I just have some resources for you guys to take a look at, just things to kind of have on hand if you want a little bit more information down the road. Okay, all right, so let's dive in. Let's talk a little bit about the lymphatic system. I'm going to talk a little bit about the components of it and what it does. So the main role of the lymphatic system is that it fights infection. And it's made up of, if you think about things that fight infection, we're talking about the tonsils, the spleen, bone marrow, our thymus gland. And then the main role of the lymphatic system is that it maintains fluid balance, works hand in hand with the circulatory system to keep everything in check. It transports lymph fluid, which is a protein-rich fluid in our bodies, mainly composed of white blood cells, hence the fighting infection role it plays. And then one of the big components in the lymphatic system is also the lymph nodes, which you might be familiar with. They are our little filters for bacteria. So, if you have a sore throat, you go to the doctor, they start poking around on your neck. If your lymph nodes are swollen, That's typically meaning that, they're revved up and they're inflamed because you've got bacteria that they're trying to filter out. So lymph nodes are a big, big player in the lymphatic system. I put in a couple of slides here just to kind of give you a visual aid of what the lymph nodes kind of look like, where they are in our bodies, and that type of thing. This page shows kind of where they are in high concentration. Long story short, they're everywhere in our body. We have a bunch of them. I think upwards of 800 in the body, 600 to 800. It's not a set number. Some people have more, some people have less, but we all have quite a few. In this picture, it's just where we have a lot of concentration. So in the neck region, like neck and collarbone region, in our armpits, and in our groin. So those little yellow circles kind of represent themselves there. This neck picture is kind of nice too. It just kind of shows a head to toe view. The little pink circles represent lymph nodes. And then you have the other components of the lymphatic system in there, from the tonsils and the vessels, the spleen, etc. You can kind of see they're all over the place. They're behind our knees, the base of our elbows, and they're definitely deeper within the body and around our favorite organ systems too. So lots of them. Okay, I'm going to jump into risk factors for lymphedema, and let me back up just a little bit. Lymphedema, just in its simplest terms, is a accumulation of lymphatic fluid. Pretty short and sweet. But the deal is our bodies are constantly producing lymph fluid to keep, like I said, everything kind of checks and balances with our circulatory system. So when someone has lymphedema, it's not that they're producing more of it, it's that the body is just having trouble transporting it. So there's kind of a breakdown in the transport system. We still have the same amount circulating, but our body, for whatever reason, is having trouble keeping it moving. So it can get backed up. So that kind of makes sense as far as what's going on when lymphedema occurs in the body. So here are our top reasons that our risk factor for lymphedema might increase. Number one is surgery. So that includes surgery that would remove lymph nodes. I would imagine many of you are familiar if you've had any surgical interventions that you might have had lymph nodes removed. It's just part of your diagnosis. The surgeon needs to look for, where are the cancer cells? Have they been contained in one area? Have they spread? And the way to find that out is to check lymph nodes in the area. So when you take away lymph nodes, whether it be a couple or many, it just bumps up your risk because you've taken away one of the components of the system. So you have a little less filtration system involved there, might slow things down. And I always say might or could because, unfortunately, lymphedema, and if we get it or if we don't get it, is a very big gray area. Obviously, we're going to be talking about how we can keep our risk low, which is good. But unfortunately, we don't have a secret formula that says if you follow these steps, you will not get lymphedema. It really just depends on a lot of factors, and sometimes there is no rhyme or reason why. But good news is it's completely manageable, and we can keep our risk low with some behaviors, which we will get to later. Okay, so surgery, lymph node removal, and then the resulting scar tissue can also be a barrier to lymphatic flow. If you kind of think about how your body heals, that skin is never quite the same again. It's not as soft, it's not as mobile. Depending on how you heal, it might be kind of tough. And I just kind of visualize it as a potential roadblock for lymphatic flow. So surgery, again, is a big one. Next on the list is radiation, which if anybody has been through radiation treatment, it is not for the faint of heart. It definitely changes the landscape of your skin, of your tissues, of your body cells. Obviously, they target as close as they can to the area that they want to radiate, but there's always that collateral damage of healthy tissue around there to a certain degree. So again, you get scarring there. It's, just changes the pliability and the softness of the tissue can kind of become more hard and stiff. The lymph nodes and vessels in the area of radiation can get inflamed because in essence we are, we're burning this tissue. We're trying to get rid of the bad stuff, and some of the good stuff kind of gets affected as well. So just a kind of an inflammatory issue going on during the radiation process. Next on the list is cancer cells themselves. Sometimes, depending on where they're growing or how fast they're growing or the size of the cells or the tumor, they themselves can block flow, block lymph nodes, block vessels. And hopefully, that process can be reversed with either, some chemotherapy, some radiation, surgery, that type of thing. But, I just think about, if you think about a highway going through the mountains, a big boulder comes down and blocks the flow of traffic. That's kind of what I visualize. It can just be annoying, get in the way, and block the normal flow of things. And then last but not least on my list here is infection. Any type of infection that the body has to incur is going to call upon the lymphatic system to help try to get that inflammation down, because that's what the lymphatic system does. So any inflammation or infection in the body is going to cause the lymph system to go into overdrive, cause it to be a little bit more stressed, and can kind of kick off that that sluggish backup of fluid if the lymphatic system has to work harder than it really should. So that's kind of the major risk factors that are involved in the onset or potential for lymphedema. Okay, other considerations that kind of umbrella over all of these are obesity or being overweight past what your healthy weight is, and a sedentary lifestyle. So this quote that I put on here is just one that I've known for a long time, and it's true. Our bodies are, by design, are made to move. So the less movement that we have, the more sedentary we are, which it's tough. We're in a society where we're sitting a lot, we're on screen time a lot, we're at desk jobs, that type of thing. So we aren't as active as maybe we once were. When I was a kid, it was like, go outside, get on your bikes and go ride around or go play with your friends and don't come home until the porch light comes on, type of thing. And it's just not that way anymore. And we work from home a lot more now. So anyway, sedentary lifestyle is definitely prominent, and it's something that we need to kind of consciously try to reverse. So, more movement in general, like I put here, means less inflammation. So the more you can move, keep your bodies active, the more happy they will be, the less inflamed it's going to be, and the less chance of having these adverse side effects, lymphedema being a big one. So, okay, we're going to move on to some hot topics in lymphedema. And the information that I'm going to give you guys comes from the NLN, or the National Lymphatic Network. I have put their website here on the bottom of the screen. It's a great place to go if you're looking for solid information. They come out with what's called position papers, and that's the information that I'm going to present here today comes directly from their position papers. It's the information that I use as a clinician to pass along to my patients, to give them solid information, kind of the latest updates on what's being recommended as far as lymphedema and just lifestyle and that type of thing. So just keep that in mind. They are a very reliable source. Sometimes when you get online and you start Googling things, you're like, what's really true and what's not true? And but this is definitely a reliable source for you. And their position papers are on their website. They can get a little wordy sometimes, but honestly, if you just kind of skim through, you can definitely get the latest updates on where things stand with lymphedema and what's being recommended. So lymphnet.org, highly recommend you have that as a resource as well. So let's go ahead and get started. So the first one I want to talk about is risk reduction practices. And that's a big one. That's something that I feel everybody should know if they've had surgery, if they've had lymph node removal. I just think it's a good thing to have and to be aware of. So this is something this is a big education piece that I teach all of my clients. It's just things to be aware of. So let's talk about keeping our risk as low as possible. So regular medical checkups are important. It's just good to be in contact with your medical team, have that relationship to where they know what's going on with you. You can ask them questions. Everybody's on the same page, and that type of thing. And that kind of goes along hand in hand with reporting changes. So if you feel like there's anything different going on with swelling in your arm, in your leg, in your hand, your foot, if something doesn't feel right and you're not sure, it's always good to follow up. Now, granted, especially if we're outside in the heat, or we've been doing something, or you wake up after the next morning after a salty meal and you can't get your ring off, that happens to all of us. That's kind of a back and forth thing that can sometimes happen. But as far as changes go, I think just a good rule of thumb is if it's been more than 24 hours and you still feel like it's just different, it's not what it used to be, or you're feeling a heaviness or a fullness that's just not going away, I think it's always good to have it checked out. Better safe than sorry. Maybe get some measurements taken by your medical team at the beginning. I'm always a fan of getting some baseline information, so that way if you feel something's off, they can follow up with measurements and they can kind of check and see what's going on. Maintaining a healthy weight is important. We'll talk about the BMI a little bit further down the road here, but just in general, maintaining a healthy weight is going to be the best thing if at all possible. It just helps with lymphedema risk. It helps with risk for other things as well, with your heart um, and your neurological system and things like that. Exercise, one of my favorites. Exercise keeps our risk lower because we're moving, we're reducing inflammation, we're getting our circulatory system moving, which in turn helps our lymphatic system move and stay healthy and active. Being aware of signs and symptoms of infection is super important. I just think, cellulitis is an infection that can occur, especially if you do have lymphedema or increased swelling somewhere, because the body again is trying to move that fluid, and sometimes the inflammation just gets to be a little much, so we have an infection set up. Basic signs of infection would be increased swelling that you didn't notice before, redness of the skin, warmth of the skin, and then flu-like symptoms are a big one. And I think some people don't always recognize that as, hey, there could be an infection here. It might not be the flu, it might be an infection. So again, I say when in doubt, pick up the phone and call. And especially if you have more than one of these symptoms, or any one of these symptoms, I still recommend that you pick up the phone and call, because a few days of an oral antibiotic can kick that right out of the system, and it's much better than having to be hospitalized and have IV antibiotics, because the stuff can move pretty quickly once it's there. So better safe than sorry. Make that phone call. Good skincare and good nail care are important. I always recommend that you use a lotion with a low pH, nothing fancy pants. I think I told the last lecture, I said, I love Bath and Body Works lotions just as much as the next person, but maybe save those for, putting them a little bit on your neck, or just using sparingly. And then if you're going to moisturize the rest of your skin, your arms, your legs, use something that's a little bit more mild, like a Eucerin or an Aquaphor or something like that, something that's low pH and very skin friendly. Talking a little bit about skincare too, really it's just kind of using common sense. If you get a cut, you get a scratch from your dog or your cat, something happens like that, just kind of be hyper vigilant about it. Clean it, soap and water, clean it, put a little ointment, Imiosporin on it and a Band-Aid, and help your body help itself heal. Because at the end of the day, we're just trying to keep the lymphatic system from having to work in overdrive. So just be diligent, be aware, and take care of that. Avoid prolonged constriction, and by that I mean tight bracelets, tight watches, maybe elastic around a blouse or something like that, that's kind of creating a constriction somewhere along the limb, whether it's the arm or leg or the waistband or something like that. Just avoiding that somewhat of a tourniquet effect, because again, you just think about it's a roadblock to flow. So just try to keep things from being too constrictive. And avoiding trauma. And by trauma, I mean, we're not talking big traumas necessarily, but some of those smaller traumas that might happen, whether it's a blood draw on your affected limb, or making sure you're wearing gloves if you're going to be washing your dishes in really hot water. Wear gloves. If you're going to be cleaning your bathtub with chemicals, using bleach for anything, using, any of the heavy duty chemicals, for whatever reason, just protecting your skin. Just think about anything that might irritate my skin if it got on there. Let me protect it, because again, I want to keep the lymphatic system from having to go into overdrive if at all possible. So that's kind of the list of risk reduction practices to keep in mind. Okay, one of my favorite topics, another hot topic that comes across a lot, is lymphedema and exercise. Can I exercise? Should I? When should I start? How much should I do? Is it going to make things worse? That type of thing. So let's kind of dive into that. So if we're talking about cardio, which is, walking, cycling, swimming, just anything that's going to get your heart rate up, whatever you enjoy, exercise classes, that type of thing. The short answer is yes. Please think about, if you're not already, put cardio exercise into your routine. It's just good for overall physical health, mental health, especially. I know for me, it's really come to the forefront that taking my daily walks has definitely helped me mentally kind of get through a lot of the crazy changes that have happened since earlier this year. So just keep that in mind. It's not only physical, but it's definitely mental. It's good for our cardiovascular system, and it's good for our lymphatic system, because they're all kind of working hand in hand. So short answer on cardio, yes, yes, yes. Find something that you like and dive in. And then weight training, that might be new to some people. Some people might already do that, but the National Lymphatic Network is definitely in favor of it. But to be cautious, be smart, start small and build gradually. And like I would tell my clients, I would tell them, I would tell you the same thing I would tell anybody, that I would tell my friends, my kids, anybody that I know. If you're getting ready to start weight training for the first time, or you're just getting back to it after some time away, be smart about it. Start small, don't overdo it, and then slowly build. And then just monitor how things are going. And we're going to dive into that a little bit more later. But just in general, weight training is awesome, and I always steer people towards it. And it doesn't have to be anything heavy duty. I know people think about weight training and lifting heavy weights, or getting muscular, and it really has nothing to do with that. I mean, body weight is considered weight training. So even if you're doing exercises with no actual weight at all, but you're putting your muscles under strain a bit to help them to get stronger, that's weight training. So again, slow and steady. For us women, whoever we have men in the audience, it's still good, but for women especially, it helps with that muscle strength, which helps with bone strength and bone density. So it's just a good overall form of exercise to consider. I do want to bring your attention, there was a couple of studies done. There's actually been a lot. I know when I first did this presentation, I talked about a study back in 2001. And I also just recently kind of went back to look and check out some other studies, and some more recent studies have come up in my search. One of them was a 2009 study from the New England Journal of Medicine, another one in 2010 from the Journal of the American Medical Association. And the short of it was, they did the study where they split people up into two groups. One group lifted weights, the other group did not do any exercise. And I'll kind of just give you a few little tidbits about it. So in the earlier study, they talked about there were 85 women in the study, 13 of which had already had a diagnosis of lymphedema, and they took before and after measurements. They did weightlifting twice a week for 6 months. They started off very small with body weight exercises, and then they moved up in very small increments based on how they were tolerating it, how they felt, but half a pound to a pound at a time. And in that study, the before measurements and the after measurements had been unchanged. So there was no increase in lymphedema or any issues like that. In the 2010 study, it was very similar. Control group that did no exercises, and then the weightlifting group that did, they actually did more of a year-long program. They were supervised for, I think, 13 weeks, they said, to kind of show them how to do the simple upper body and lower body weight exercises. And then for the rest of the time, they were on their own. And the short of it was, in the control group, or in the weightlifting group, 11% of the women in the study developed what they call lymphedema. And the definition of that is basically just a 5% increase in their pre-measurements to their post-measurements. That's kind of the clinical definition. But the interesting part was too, the women that did nothing, that did no exercise, there was actually a greater incidence of lymphedema, 17% as compared to 11%. So it just kind of goes to show it's something to really think about. I can stay home and do no exercise, and my risk is just as great or maybe even greater than if I'm working out and weightlifting. So it's kind of like, weigh it out. Should I just stay home and do nothing because I'm afraid I might get lymphedema? Well, that kind of doesn't really hold water because it can still happen. And there's just so many more benefits to being active and finding exercise that feels good to you. So just kind of show you how that works with the studies, and that lymphedema and exercise can work together, and it's not something that should be feared when done, appropriately and cautiously. Okay, so a little side note too about exercise and compression garments. That's something that I got a lot of questions about. Should I wear a sleeve? Should I wear a compression garment when I'm exercising? The NLN says at the end of the day, there's no strong evidence that says, if you wear a garment, you're better off than if not. But there's kind of a big but, or however. They do recommend that if you have a diagnosis of lymphedema from your medical team, that you do wear a garment during more vigorous exercise. So maybe and then that's going to really depend on the person. And if you're out just taking the dog for a 10-minute walk, that might not be vigorous. I mean, maybe it would be depending on your dog. I have two, and I sometimes have to vigorously try to keep up with them. But, if we're talking maybe going for a run, doing an exercise class, those types of things, actually wearing a garment might be working for you as far as helping to reduce swelling, because as your muscles are pumping and it's pumping against that compression of the garment, it acts as a pump to help move that fluid along. So they do recommend that you wear a garment if you do have a diagnosis and you're vigorously exercising. If you're at risk for lymphedema, but you're not officially diagnosed, it's kind of a case-by-case basis. And, I always say it's to your comfort level too. Maybe start getting back into your routine, taking walks or doing what you're doing, and then just monitor. How's it going? How's it feeling? And, just check in with your medical team, and then you guys can kind of make that decision as you go. I will say here at the bottom though, always make sure that your garment fits you well. I highly recommend that you get a professional fitting. You get measured and fitted by someone that's certified to do so. You can go on Amazon any day of the week and look up compression garments, and you will see a wide range of things. But I highly recommend that you either, try to get a referral to a lymphedema therapist, or, if you have a nurse practitioner, or, your doctor's office can refer you out, they do have places that have certified fitters that can measure and make sure that you have a good fitting garment, because wearing a garment that doesn't fit, that's too small or too big, is kind of like not wearing one at all. So you need to make sure that it's a good fit, and you're going to get the most benefits from it. So that's exercise and compression garments. If you're going to wear one, make sure it fits well. Case by case basis, as far as if you're at risk. If you do have a diagnosis, they do recommend that you wear a good fitting garment just to provide that support. Okay, so the bottom line to exercise and lymphedema is this. It's definitely part of a healthy lifestyle, and it's very effective in managing lymphedema. We definitely would like for you to consult with your medical team first. I think it's important that everybody's on the same page and that your care team knows exactly what your plans are and what you plan to do, so that if there are any questions or concerns, that they kind of know what's going on outside of the clinic visits. Slow and steady progression is very important with any exercise. If you can, if at all possible, get a referral for a certified lymphedema therapist to be on your team, to just get that baseline of knowledge and just to be able to go back and forth and share information and ask questions. I was always super excited to have people come into my clinic, and we kind of developed, you know, a very long friendship, and, you know, emails back and forth, and just, you know, being able to check in with somebody who knows what's going on is always comforting, and they can help you along the way. And then, like I mentioned before, with the studies, your risk of getting lymphedema is pretty much the same, if not more, when you're being sedentary. So it's really down to weighing the risk of being sedentary and what that entails for your lifestyle and your health versus being active and getting lymphedema. Just kind of have to weigh those out. And I know my answer is going to fall on the side of being active, to your comfort level and to your abilities, because it's just overall, I think the benefits are going to far outweigh the risks. So that's the deal with lymphedema and exercise. All right, next hot topic is air travel. That's something that I get a lot of questions about. If I fly, should I wear a garment? What's the deal with that? And again, NLN recommends that if you have a confirmed diagnosis, that you wear compression. And again, make sure it's a good fit for the reasons that I mentioned before. And if you're at risk, but not officially diagnosed for lymphedema, again, consider it. Talk with your lymphedema therapist, talk with your medical team, and kind of go from there. It really is a case-by-case basis, and we want you to just be aware of the risks and kind of weigh it out with your team. We don't want you to feel like you have to make these decisions on your own. That's why I'm always, you know, always a proponent of staying in touch with your medical team so that they can help you make these decisions, and you don't have to kind of just wing it and make these decisions on your own. So, and just some factors to consider for air travel is that, you know, there is decreased air pressure in the cabin. So, you know, we've got, you know, our atmospheric pressure as we're walking around in regular life. We get on the plane, it's decreased. We get off the plane, it's back and increased again. So just that, those pressure changes can sometimes be an irritant if you have lymphedema or if you're at risk for it. Flying is generally a very sedentary activity. We're not really moving, if at all. We're sitting in this kind of tight little space for, you know, hours at a time sometimes. So just consider that, you know, we're not getting up and getting that natural cardiovascular movement, muscle pumping type of thing as if we were taking a walk. So I've always been a proponent, especially on longer flights, that if the seatbelt sign goes off, you know, get up and stretch your legs, walk up and down the aisle 2 or 3 times. I mean, there's nothing wrong with doing that, and it's definitely helpful. I always get the aisle seat because I like to stick my long legs out in the aisle when it's safe to do so, just to be able to stretch and kind of move my ankles up and down and bend and straighten my knees and things like that. So flying, you know, by nature is sedentary. We're not moving if at all. So Lifting and carrying heavy luggage can sometimes be a thing. If you have somebody else that can do that for you, I highly recommend that you give that task to someone else. But, sometimes you're on your own or you're just not even thinking about it and you're picking up heavy luggage. So that might be a strain, obviously, especially on your upper body. So keep that in mind. And then, flying is just dehydrating overall. The air in the cabin is dry. I know for myself, I do pretty good with drinking water, but it doesn't take much change in my regular routine to derail me, and I forget to drink water. If my water bottle is not sitting or in my line of sight at all times, it's something that can kind of fall by the wayside. So just remember that flying in general is kind of pushes you into some of those higher risk categories with sedentary activity, dehydration, um, more stress and strain on the body, and then the air pressure issues. So again, just talk with your medical team and see if they think it's appropriate for you. I just put the lymphatic networks, the NLN's website back here at the bottom too. Again, their position papers on this specific topic are online on their website. Okay, and then just some miscellaneous considerations to think about, things that I've discussed on a pretty regular basis, with my clients are, taking blood pressures, drawing blood, needle sticks or injections on the affected side. First and foremost, the NLN has a position paper on this as well, and they have said, just through the research that they have been collecting, that at the end of the day, there's no conclusive evidence that a single exposure is a problem. So if you're in the hospital, you're groggy, somebody takes a blood pressure on your left arm and you're like, oh no, I needed to tell them it was on my right arm. It's not, your chances of that causing lymphedema are not, there's no conclusive evidence that that's going to be a problem. Granted, if you have, you've got two arms and you've got two legs, use the unaffected side just to be safe, but there just might be circumstances where either, I gave the example of, what if you passed out at the grocery store and nobody was around to say, hey, don't take blood pressures on her left arm. And the EMTs do so. Again, not the end of the world, but just do your best to make sure the unaffected side is the one that gets out that action. I know those medical bracelets come handy sometimes, and I've actually seen some pretty cute ones. They're not as plain Jane little metal bracelets as they used to be. I've seen a lot of people that have worn kind of some blinged out medical bracelets, so that might be an option as well. Surgeries, that's a little bit bigger than a blood pressure or a needle stick, so it's definitely something to discuss with your surgeon, discuss with your lymphedema therapist or your medical team, and just have a plan at the end of the day. If you have to have surgery, obviously that's going to be a stress on the body, especially if it's anywhere near the site where you're already at risk. So again, having those discussions, making sure the surgeon knows exactly, knows all your medical history, which hopefully they would do, before you would go for surgery anyway. But just discussing all the options, and then again, having a plan, whether you have some kind of pre-surgical interventions from a lymphedema therapist, and then some post-surgical interventions, again, just to help the body heal and to not, just to reduce the stress as much as you can on your lymphatic system. Just have a plan, have the knowledge, and just communication across the board with everybody involved. Mammograms, another one. There is no evidence of, having your annual mammogram causing or worsening lymphedema. So keep up with your mammograms. Razors, again, no evidence of causing or worsening lymphedema. Just be smart about it. Make sure your razor is clean and in good shape, and that your skin is clean and you're not shaving over, broken areas of the skin or anything like that. I know some people are like, well, I'm just going to go to the electric razors because that will just reduce the risk of me cutting myself, which is all well and good. Me, myself, I think electric razors kind of stink. I'm not a fan. They just don't work like the regular razors do. So again, personal preference. I mean, whatever makes you feel comfortable, but just know that if you're smart about it and you're practical about it, again, no issues as far as causing or worsening lymphedema. Okay, we are going to shift gears a little bit and talk about body mass index and how that relates to exercise and things like that. So this little picture of the baby I thought was pretty hilarious. It's kind of like, yikes, where do I fall? What's my number? You know, it's like, I don't know. I don't like putting in those calculators and seeing that number pop up. It makes me nervous. Like, oh geez, where am I going to fall here? So the BMI is just stands for body mass index. It's from the National Institutes of Health. It's a pretty bare bones scale. Really, it just correlates between your height and your weight. How, you know, where's the correlation between your height and your weight, and then where do you fall on the scale? So there are the numbers. And you know, it doesn't really, it's not the end all be all, like I put here. It's a good starting point. A lot of doctors use it just to kind of see where you're at. But again, I think it's not so black and white. I mean, you really have to look at, you know, how active you are. It's not just spitting out a number and that's that. But it's a good starting point. So again, it doesn't account for your activity levels. We need to look at body frames. We need to look at activity levels. And there was an article that came out about a year ago talking about BMI and does that really correlate to health? And I put a couple of pictures here. You know, we've got these elite athletes. We've got LeBron James on the left. We've got Tom Brady on the right. If you plug in their height and weight to the BMI calculator, they both fall into the overweight category. So, I mean, clearly these men are in tip-top shape. We would not be worried about them and, you know, being overweight and having any issues. They are both elite athletes. But if you strictly go by height and weight, Tom Brady is a 27.4 and LeBron James is a 27.5. So they're like smack dab in the overweight category. So it does give you pause. It's not the same. You know, it's not the end all be all. Granted, we are not all elite athletes, so I think it is a good place to start and just kind of see where we go from here. I mean, I think we all kind of know when we feel like we are at a good weight and feeling healthy and feeling, you know, well versus when maybe we are a little outside of that range and we're not feeling as great. So again, ongoing conversations with your medical team to kind of keep that in check as much as possible. So really the biggest takeaway from the weight issue is that if you're overweight, you have more fatty tissue, more adipose tissue in your body. By definition, that is just more fat tissue just means more inflammation in general in the body. So we're really trying, again, to keep inflammation down. That's kind of the main thing. So if you have increased fat, it can cause or worsen other conditions, some of which are right here. You know, we might have reflux going on. Gallstones can be a problem when there's more fat in our bodies. Insulin resistance is a big one, which can lead to diabetes. And that's just, you know, another road to go down as far as the health factors that are involved, you know, with being diabetic. As fat cells produce estrogen, which we know, or, you know, if we're trying to control, you know, some of our cancer tumors feed off of that. So we don't want necessarily more estrogen happening in the body with those fat cells. And then just in general, they're just not, I don't know, they're just, I can just picture just kind of these big lumbering fat cells that are just kind of in the way and crowding out the good stuff. So they are just by nature, they're larger in size. Fat cells are than muscle cells or things like that. And they do tend to crowd out oxygen circulation. So if you think about it, it's like, you know, your body's trying to bring healthy oxygen to tissues, and these fat cells are just kind of in the way. It can trigger inflammation. This was just a study that was done by Anthony Anderson that I found that just kind of rang true to me, that it just brought out a nice image to kind of show that, you know, these fat cells are, you know, they're kind of sneaky. They're really up to no good. They're not really doing us any favors as far as eating a healthy, decreased inflammation environment for our bodies. All right, let's move on to my favorite topic, exercise guidelines and how much we should be doing and how it's going to help us. So, exercise guidelines come out from the US Department of Health and Human Services. The very first report that came out as far as what they recommended, you know, minimum exercise per week. The first edition came out not that long ago, it was back in 2008. They did update it again in 2018, so it's been updated just a couple years ago. But the actual minimums per week haven't changed. So they recommend, the guidelines recommended are 150 minutes of moderate exercise per week or 75 minutes of vigorous exercise per week. So if we talk about, you know, well, what's moderate, what's vigorous, what does that mean for me? Moderate exercise is walking, cleaning your house. And by cleaning your house, not just like wiping down the counters, cleaning your house, like cleaning the bathrooms, mopping the floors, dusting, vacuuming, you know, getting up and moving and getting a good cleaning going on. I kind of joke with my friends that I consider kitchen dance parties a moderate form of exercise, because who doesn't like a good kitchen dance party? You put on some music while you're cooking or cleaning and you're getting in some steps and you're having a good time and it's good for your mood. So I highly recommend kitchen dance parties if you haven't tried them already. It's one of my favorite things to do. And then vigorous exercise would constitute something that's just a little bit more intense. Running, an aerobics class, you know, like Zumba, or, you know, just something along those lines where the heart rate's really getting up much higher. So back to the minimums. If you're looking at moderate, which I think all of us are, I think we're just capable of doing that. I take walks every day with my dogs. I take a 20-minute walk, unless the weather's crazy hot. But even I'll just go by myself, or I'll get on the treadmill for 15 or 20 minutes at a clip. So if you look at the minimums per week for moderate exercise, it really boils down to about 20-ish minutes per day, and you're covered. So it's really not bad. I mean, a 20-minute walk every day, I think we can all handle that. And I personally like to see people, you know, some people are like, well, can I do like 2 10-minute walks a day? And honestly, I think if that's all your body can handle, especially if you're going through treatment or there's other things going on that are really causing you to be fatigued, then the answer is 100% yes. I would rather have you do 2 10-minute walking jaunts than nothing, because we definitely don't want to get into an all or nothing mindset with this. Just because you can't do 20 minutes all at once doesn't mean you should do 0. If you can do 5 or 6 minutes at a time and then you get pooped, go for it. Just do whatever you can do. If you can work yourself up to 20 minutes at a clip, hallelujah, that's awesome. I mean, we're all coming at this in different angles, different levels of health and that type of thing. So you just have to give yourself some grace and just start where you are and work from there. But these are just good guidelines to follow, just so you know kind of that you're getting what the Department of Human Health Services has determined is just good for our bodies. Their website is here at the bottom, health.gov, and they have their handy dandy reports there that's very easy to read and follow. So if you want to check those guidelines again, feel free to do that. One of the things that I wanted to talk about too is, you know, that I mentioned that the first edition of these guidelines came out in 2008, and then 10 years later they put out another edition. And honestly, the updates that were made really had more to do with the benefits of exercise. Like I mentioned, the minimums didn't change, but they have just discovered over the years that beyond the physical benefits, there are so many more benefits to exercise, which I think is important to talk about. Brain health, sleep, reducing fall risk, and those types of things. So they really talk a lot about more of the mental and brain health and what exercise can do for that, how exercise can actually play a part in reducing risk for certain types of cancer or reoccurrence of cancer, and just and then they also talk about, hey, if you're sedentary, you need to be aware of the risks of not exercising. So I think they really kind of stepped up their game. And not only is like, hey, you should move because you should be physically active, but even beyond that, it's good for brain health, it's good for balance, it's good for reducing falls, it's good for better sleep, and it also just really makes a difference, in your overall health versus being sedentary. So I think that was an important update and information for them to bring out. All right. Oh, and let me go back real quick. The guidelines for these for exercise from the Department of Health and Human Services, they are for all individuals 3 years of age or older, is what they've laid them out for. Now, and they also have, if you go onto their site, they do have, special considerations for other populations, whether you're pregnant, whether you have a chronic illness, and those types of things, and just how you can kind of moderate your exercise to still participate in physical activity, but how to monitor that and moderate that to do it smartly and safely. So I think I applaud them for doing that, because it's like, this includes everyone, but it's not black and white. There are areas of gray here, and we definitely want everybody to get up and move versus not. So they do provide those guidelines for special consideration. So I think that's awesome. Okay. Last but not least, just a few resources that I wanted to share with you. The first one is the NLN, and that's the one I've been talking about the most. They're the ones that have come up with all these position papers, like I mentioned, on air travel, exercise, risk reduction practices, and those types of things. So I think that's a good resource to have. And then I'm going to skip to the bottom and talk about YouTube. If anybody's interested and kind of wants to geek out a little bit on the lymphatic system and how it actually works in the body, I love Khan Academy. You can go to YouTube. You can just put in the search bar Khan Academy, and just put this right in, lymphatic system education. And they just have the coolest, simple, they're almost like little cartoon animated things, but I'll tell you, it really brings it home on how the lymphatic system works. And I think it's pretty cool. It just kind of breaks it down. I know when I was studying more specifically about the lymphatic system in my certification class, I started to kind of get my eyes kind of glazed over, because it's hard to kind of sometimes conceptualize the checks and balances that our body has, and the vascular system and the lymph system and all that. But this is just a cool way to kind of see how everything works. So if you want to geek out on that, that's a good place to go. But back up to the World Cancer Research Fund and the American Institute for Cancer Research. Those are their websites there. They work hand in hand to develop what the latest kind of cancer prevention recommendation guidelines are, which I think is pretty huge, because whether you've had cancer in the past or you're trying to keep your risk low, all of these recommendations apply. And I think it's just a cool kind of go-to resource to see how you can maybe make some changes for the better in your life when it comes to diets, physical activity, and that type of thing. So to tie in to the WCRF and the AICR, the two of them combined together to come up with what's called the Continuous Update Project, or the CUP. It's kind of a long website there, but highly recommend that you check that out. I think it's a really cool thing. I came across this a couple of years ago, and I just thought it was pretty awesome. So what this is that it is, I'm just going to read my notes here so I don't forget anything. It's global research on how diet, nutrition, and physical activity affect cancer risk and survival. And basically what it is, it's a conglomeration of smarty pants people all over the world. We're talking like MDs, PhDs, and researchers. and they come together, and scientific research from around the world is added to a database on an ongoing basis, because there's always research being done with cancer and prevention and just all kinds of stuff all the time. So this is a kind of a one place database that they come there, they review it, this independent panel reviews it, these experts review it, and then they evaluate it, they interpret the evidence, and then they make conclusions. So it's kind of like they do all the work for us. We don't have to start Googling all these research papers, or just try to kind of put it all together and like, what does all this research mean for me? What should I do? What's the best approach? So if you go to that website, it's really a very user-friendly thing. It breaks it down into what cancer prevention recommendations are from of the World Cancer Research Fund, and they review it and revise it as needed, just depending on the research. I don't know how often they meet, but I know it's on a fairly regular basis that they're reviewing this research, and then they're double checking, hey, do we need to revise any of our recommendations? And I'm just going to list off what some of those recommendations are, and then underneath each one, they give you a really nice explanation. And they just talk about, being a healthy weight is important, being active, eating fruits, veggies, and whole grains, limiting fast foods, quote unquote, limiting processed and red meats, limiting sugar sweetened drinks, talking about alcohol consumption and how to balance that, trying not to rely too much on supplements, breastfeed if you can. There's a section on breastfeeding, and then there's a whole section on after if you have a cancer diagnosis, kind of how you should proceed, and how you can kind of follow the right guidelines. I know I would have people coming in all the time asking, should I not eat fruit because sugar can potentially feed cancer tumors? Should I drink celery juice? I mean, you name it, it's out there, and you want to do the right thing to take care of yourself. So this definitely, I feel like, leads through some of those murky waters and gives you solid information. Now, granted, you always want to talk to your healthcare professionals and your medical team before you do anything out of the ordinary or you make any changes, but I will say this is very solid information, and I think it's pretty awesome that they do that, because it just gives you a place to go where you're going to get the most up-to-date researched information out there. So I think that's pretty awesome. So highly recommend checking into that. Real quick, these are some of the handouts that I have that I gave out in person, but I wanted to put them here. This one here, this one, it's actually all one page. I had to break it up into 2 slides. But this, you can find this Healthy Habits. You can find that on the NLN website or the lymphnet.org. You can find that there and print that out or save that if you want to get back and refer to that. Healthy Habits. This one I think is pretty cool. It's a lymphedema action plan, and it kind of gives you, green, yellow, and red zones, things to be on the lookout for, and when to call your healthcare providers, what to do. It just kind of gives you a nice little framework. So the website, I think it was super long to try to type out. So if you just Google lymphedema action plan, or it's referred to as LEAP, you'll be able to pull this up. I think, again, it's very straightforward, giving you education on kind of knowing what zone you're in and maybe when you need to ask for additional help. So love that one. So just Google LEAP or lymphedema action plan to find that. And then this one here is from the American College of Sports Medicine. Another great handout, just showing the effects of exercise on health-related outcomes in those with cancer, and just what guidelines are put in place here and how that can help, whether it's fatigue, quality of life, physical functioning, anxiety, depression, all of those things. Again, mental, physical health, super important. There's lymphedemas down here at the bottom. Again, lymphedema is just one of those gray areas. There's still that quote quote inefficient evidence. So hopefully in the future, I know people are hard at work researching lymphedema and exercise all the time, but I think just the studies that I've provided kind of give you the idea. You can kind of see where doing nothing and doing something is not going to put you at in any better or worse position. So think about what what some of the other benefits of exercise are and kind of go from there. So that's this page and this page. Bone health, sleep. Again, there's the website there in the lower left hand corner, which is going to pull up this if you want to see that in the future or save that for yourself or print it out or whatever. So yeah, I think that is it. So again, thank you guys for coming today and spending some time with us and learning about this topic. It's definitely a passion of mine, and I'm glad to share my information with you. So thank you so much. And that's it.